I actually come from a family of nurses. My mom is a nurse practitioner. My older sister is a nurse. And when I was younger in high school, I went up to my mom's job at Kings County Hospital. And I was really fascinated by how the nurses helped all the patients, how, you know, the stories my mom came home and told me about how the patients came in, you know, not doing good, and how when they left they were so much better. And I was really, really fascinated. So I knew from a young age that nursing was in my blood, and that was something that I definitely wanted to do. I wanted to be a nurse because I wanted to be in a profession where I can help teach others as well as healing. And I felt like nursing is the perfect opportunity for me to do.
I chose nursing because growing up, I always took care of my sick sister. She was an asthmatic, and then she became a nurse. Eventually, like, the profession just like drawn out to me, and I was like, I want to be like my sister. And then I realized, like, I love to help people. I loved helping sick people, old people, all of that. So eventually, like, the career crawled out to me, and like I just became a nurse after that.
I will share with you that I've always wanted to be a nurse. And I was the first one in my family to go to college. And my dad was like dedicated to making sure that I graduated from college. And when I told him I was going to be a nurse, he said, "Why would you want to be a nurse? You could be anything you want to be." And he thought I was a leader, and he thought I was smart, and he said, you know, you should pick another profession. But I always stayed with nursing, and I never regretted it. My dad was born in Cuba, so he thought of nurses as being maids, right? He didn't see nurses as nurses are today. So I'm not sure why I became a nurse. I know I made the right decision, and I know that I never regretted it 1 minute.
I initially did not want to be a nurse, honestly, but when I was in nursing student, I had a chance to go another country as a medical volunteer, and that was my eye-opening moment. And I realized that I don't need to be stuck at the hospital, keep sticking patient with a needle. So I passed my exam, and then I'm here. I'm so happy to be a nurse who can help all other people with all my knowledge, and then using resources to make people different.
I chose nursing as my career because I love taking care of people from a very tender age of 6. I was entrusted with my first newborn nephew, and till this day I still take very good care of him. He's like my son. He is now 23, and I really love taking care of him, and he now has other brothers and sisters, and I realized I was really good at taking care of people. So I thought, what's a better way to take care of people than go to school for it? And that's what I did, and I'm very happy where I am and helping others, helping people in my community as well, and also here at MetroPlus. Number one reason that I love being a nurse, it has helped me grow. Being with MetroPlus and servicing our members makes me really happy. So I continue to do that with joy.
Growing up, I actually had the passion for helping people. And when I pursued my career, I actually didn't pursue as a nurse initially, but then my dad got sick. I went to the hospital, and I realized my passion was nursing. And just seeing the level of care that he was getting, I decided that I needed to change career, and I, pursued nursing, and I realized that when I perform my duty, I feel very fulfilled of my day. I am able to impart knowledge, and that really gives me the satisfaction that I'm really helping people. And this is really a true compassion of mine.
The reason I chose nursing as my career is that I like helping people, especially like elderly people. I like talking to them. Here I get to talk to people at home before they end up getting very sick, discuss what things they can do to take care of themselves. That's really gratifying that you bring to them discussions about their health concerns that they may not discuss with people. They talk about other things with their friends, but here we talk about things to keep them well.
So I became a nurse almost 20 years ago because I really wanted to work in HIV, and my mom is a nurse, and I spent a lot of time, growing up helping her out at her job. Not really helping, but I was there, and so I just knew that that's something that I wanted to do. And I have a lot of friends and family members who have been affected by HIV, and so I wanted to work in HIV, and I was fortunate enough to do so, and I'm glad I did.
I like helping people, and I had an experience way back when I had a premature niece born at 25 weeks, and it was really an inspirational thing. I wanted to work with mothers and babies, and that's what I've been doing most of my nursing career.
I love nursing because of all the different things I can do. And I started out pretty traditionally in med-surg in the hospital and went into critical care. I really enjoyed also doing home care, and I've been able to try different things. When I was in Alaska, I was a flight nurse for 5 years, and also did emergency nursing, legal nursing, and management. And of course, full circle came back to case management, which I really love. So I would say that being able to really impact people's lives and do it in very many different ways has been one of the things I love about nursing.
I chose nursing because it's a field that's very broad and it's very dynamic. There's a lot of different opportunities within the nursing field. It opens up a lot of doors. Personally, I was able to be in the field and do a lot of community health and public health work, which is very important to me. And it's something where you could go into administration, you can go into health plans, you can go into care management. There's so many opportunities, and my own mother actually became a nurse after I did by seeing the different opportunities that there are, and my encouragement, of course. So it's just amazing that this was something, her second career in life, and she's loving it as well. So it really does open up doors for a lot of people.
Nursing is a profession that provides for career growth opportunities, job stability, and schedule flexibility. Above this, my main reason for going to nursing was my passion to help people. Even as a child, I've always had passion, have that model instinct to help my sibling. I'm one of 11 children, so I've always been the one planning and caring for everyone. And when I became an adult and had the option to choose my career path, choosing nursing was just easy for me. And for the past 17 years, you never get old. I always still have that gratification, fulfillment whenever I'm able to help a patient with find a solution to whatever the problem is. I remember as a visiting nurse, each time I go see a patient, they're in pain, I administer medication, the pain goes away, I get fulfilled. Or as a visiting nurse, I see a patient that has wound care, that has wound, and I've been providing wound for few weeks or few months based on the severity of the wound. And after a few months, the wound is healed. It's always magical to me because I always have that passion and eagerness to help people.
My journey as a nurse started when I was a teenager. I became very intrigued about how the body worked. So I actually attended Jane Addams Vocational High School as a teenager, and my trade was nursing. I studied for LPN. So I graduated from high school at 17 as an LPN. So I've been a nurse for over 35 years. It has been one of the best professional choices I've ever had. It's been the most fulfilling job I've ever could have imagined. My motto for nursing has always been treat people how you want to be treated. And knowing that when someone is ill or someone is in need of a service and they're so vulnerable, that I can have the most positive impact on them and treat them how I want to be treated if I was in their position. It has been such a fulfilling journey for me in these 35 years as a nurse. I cannot even express the gratitude that I have when I encounter anyone and provide them with the care, the education to help them along their way. It has been just the most fulfilling aspect of my life.
I love the fact of taking care of people And once I got into nursing school, I realized the dynamics of nursing, that nursing, you can start nursing at the beginning of life and you can also see nursing through the end of life. And I chose geriatrics in my early nursing career because I just love being there and taking care of the elders. Nursing is very fulfilling.
For me, it was very easy. Being able to help people on the everyday basis, every day, working and helping.
I come from a long line of nurses and doctors, and seeing my family members practice, as long as when my grandmother became ill, just the compassionate care she received, I was like, wow, I knew I had to do it. It just made me think like, okay, this is something with a purpose. This is something I can do that I can give back with. And I'm like, here I am, a nurse.
I think I was born a nurse. For as long as I can remember, from a little girl, I couldn't think of anything else. You know, as a matter of fact, when I was in 5th grade, we had these little autograph books when you graduated, but the front page said, your profession. And I looked at it recently and it said nursing. I was 10 years old. I already knew what I wanted to be. And I remember on my graduation picture, my mother having to buy me a cap, but she bought one without the black ribbon across. And the black ribbon signified that you were a registered nurse. So she put a black ribbon across my graduation picture. I would say that the only thing that really drew me to my favorite population, which is the frail elderly, is my grandmother. Always wanted to make sure she was okay. I get emotional. I always wanted to make sure that she went to the doctor, she took her medication, that she was well taken care of. Therefore, my favorite population is the frail elderly. Everyone deserves good care and everyone deserves to age with dignity. In my nursing career, I've had so many opportunities. I worked in acute hospital, I worked in the community, I was the Project Y 2K when the world was going to end. I was the project manager. They wanted a nurse to do that. I've worked in managed care. I've been blessed and I am proud to be a nurse, and I really can't wait what the future generations of nurses will accomplish.